Dr Manukyan. I'm a GP and headache specialist working in National Migraine Centre. I'm going to answer today some the most asked questions on Google about migraines and give mini overview of migraines. So I've got first questions: how are migraines diagnosed? There is no specific test to diagnose migraine. Usually doctors ask lots of questions about history of headaches and associated symptoms, and then do neurological examination, and if it's all normal, then usually based on history we diagnose migraine. Some doctors also perform blood tests or request head scans when it's not very obvious it could be migraine, just to rule out some other problems. Basically, if you have recurring headaches with associated nausea, light sensitivity, feeling ill and missing work, and then following that you fully recover between the attacks, and most likely because of your headaches are migraines. The next question: how are migraines caused? We know now, following lots of research, that migraines are complex brain disorder, and they are usually inherited. About 70% of migraineurs will have a first degree relative who would suffer with recurring headaches. So what happens? You inherit tendency to develop migraines, and your brain cells have certain electrical instability, and in response to various triggers you get a migraine attack, which is usually can be compared to electrical storms. So there are electrical changes in the brain cells, they're leading to electrochemical chain reaction, and then you develop various phases of migraine. So like similar to a thunderstorm, you may have a prodrome when you have a cloudy, foggy brain, like overcast weather. You may feel a bit nauseous, tired, and then about 30% of migraineurs develop aura, which is a brief neurological symptom, maybe loss of vision, confusion, loss of speech, or tingling. And but most people would develop headache first, so it will be most intense headache with nausea, sensitivity to light, smell, noise, and they might need to lie in and take medicine to recover. So when migraine completely clears, usually hours, a few hours later or a day later, then the weather, it's like changing the weather, so everything becomes sunny and bright. The next question is: how are migraines triggered? So the triggers are some changes in your body clock and a routine with meal times usually, and sleep deprivation or oversleeping. There are migraineurs who are very experienced and had lifelong migraine, sometimes able to correctly recognize their triggers, so they avoid caffeine, they avoid alcohol, they make sure they sleep in time, and try to de-stress, exercise regularly. There are some migraineurs who become very preoccupied with triggers and research lots of food triggers, and trying to avoid, and which leads to a very restrictive diet, and they become imprisoned with their fear of triggers, and sometimes just trying to search for a particular trigger can be very stressful and cause more and more migraines. How are migraines treated? So the main approach for treatment is we offer treatment for attacks if they are infrequent. So there are painkillers, typically anti-inflammatory painkillers, combined with triptan-specific migraine chemicals. When migraines are too frequent or very difficult to treat, then we offer prophylactic treatments. So there could be medications you take every day for a while, just to increase the threshold of your migraine and reduce sensitivity to triggers. So something like amitriptyline, topiramate, There are exciting news about development of anti-migraine antibodies, which are able to block migraine activity in the brain and stop the attacks. But there are still old-fashioned treatments we use which can be very successful. Other than medication, there is improvement in the lifestyle, routine in sleep and meal pattern, avoidance of stress and triggers, as we mentioned, and there are some electromagnetic devices available to treat migraine or reduce the severity and frequency. And another question, how are migraines different from headaches? So this is quite frequently asked by patients, so head pain is just one symptom of migraine, and as I mentioned, there are lots of associated other symptoms, but typically in migraine, headache is very intense, quite disabling, accompanied by nausea, light sensitivity, stomach disturbance. Headache can be also a symptom of other illnesses. For example, if you have a fever with a cold, you would be a bit headachy. It could be a symptom of meningitis and other conditions. So what I tell my patients that headache is one symptom of migraine, so I use word migraine to describe, not just to name the attack, but describe the tendency you've inherited and diagnosis and susceptibility to develop recurring headaches in response to various triggers. Hope you've enjoyed the choice of questions we prepared for you, and I'm looking forward for more sessions.